Conversations with the Citizen. I am your host, Tia Carol Jones. I am here today with Iris Patterson. Iris is a certified holistic nutritionist and certified health and wellness coach, as well as the founder of Chicago Integrated Health. Welcome to the show.
Thank you. Thank you so much for having me.
Thank you so much for being here. Tell us a little bit about yourself.
So I am a licensed clinical massage therapist, certified holistic nutritionist, and certified health and wellness coach. I am the founder of Chicago Integrated Health and Iris Botanicals. So I, fell in love with health and wellness a long time ago when I became a licensed clinical massage therapist.
Okay. What is Chicago Integrated Health, and why did you want to start the business?
Chicago Integrated Health is a lifestyle management practice that we launched pre-pandemic back in January of 2020. We took our first clients at the end of 2020. We launched because I found that it was a growing epidemic of heart disease and diabetes. It took my family members. My mother was diagnosed, and I said that I want to make a difference in this world, and we added many components to it: mental health therapy, nutrition, fitness, and massage therapy to combat anxiety, depression, and lifestyle diseases. And so we work hard to bring a shift, to fight against lifestyle diseases like diabetes, heart disease, cancers, hypertension, all of that can be have a snowball effect and cause more chronic disease.
And you said you are a certified holistic nutritionist and a certified health and wellness coach. Why is nutrition, health, and wellness so important to you?
It saved my life. Years ago, I was diagnosed with bipolar depression. I'm not against medication at all. I feel that it's necessary, especially if it's a hemorrhaging going on where you're trying to save your life, and stop the effects of whatever disease you're fighting against. But I felt like in the midst of my depression and bipolar disorder, I had a little bit more time to take a more holistic approach. I asked my doctors, just give me 30 days. Let me try adding eating to heal. Let me try fitness. Let me try de-stressing, and in a more holistic way, and let me see what happened. And I found that those components is what, of course with God, those components is what saved my life. And that's why Chicago Integrated Health has the fourfold approach that we created. I studied the sciences behind it, and every last one of those components trigger the brain in a positive way.
What can clients expect from the services at Chicago Integrated Health?
So our motto and tagline is finding your happy place in health. And we are a safe space where you can come in after you've talked to your physician about working with us. You come in, you will share with me your diagnosis. We will read your labs. We will then create a care team with you. With that care team, you have a certified nutritionist, you have a licensed mental health therapist. You also will be, because I have a certification in strength training for weight loss, we will be doing exercises. And then if you want to add the massage therapy in-home component, you can add that. And together, we discuss, your care team, have conversations about how we can support you. If you, share something with me, you might not have shared with your therapist. I will let you know, I'm going to share this with your therapist, but you should talk about it, and it becomes a great connection, a carryover. What we finish with here, it picks up with your therapist, and it picks up with your massage therapist. Typically, our clients see see me twice a week, and a therapist once a week. And if they had a massage, therapist on staff for them, they might see them once a month, twice a week, however they need. And then with that, we grow with you. One of our clients was like, I feel so supported. I have people who actively check on me, actively know what's happening in my life, and want to know how they can better support me and help me to build coping skills. Teach me, new tools that I can use when I'm overstressed in the workplace, breathing exercises, how to eat properly to ward off disease and infection, and preventative methods. One of our clients, her A1C dropped, and that the A1C measures, that's if you're diabetic or non-diabetic, and her A1C dropped from a 10 to a 6 within 37 days of us working together. I typically talk to you how to eat, to heal and all of that.
As you said, Chicago Integrated Health also has a meal prep coordinator and a psychotherapist. Why do you think those components are necessary to have a holistic approach to health and wellness?
Yeah, so when we eat, disease and overeating and all of that is deeply connected and rooted sometimes with the environment we live in and our behaviors. And so you're not your parents' disease. You could definitely, have the ability to develop cancer, heart disease based on your relatives. But if you change the environment, you can potentially reverse that. And if you handle the stress in your life and learn new tools and not repeat some of the same ways of dealing with trauma, like your parents, you can very well have a different outcome. And so if you dig deep and think about the deep psychological root to how you got here, you have a better chance at changing the future. So with a psychotherapist, they help you deal with the trauma of the past. Eating to heal is real. It's real. You reduce the inflammation in your body. You ward off infection. You give your body the tools it needs in order to fight disease based on how you eat. And so those components paired together make for an awesome immune system when you're done. Stress can lower your immune system. So if you don't have an outlet to talk about what's happening, what's going on in your life, why I'm feeling down, why I'm feeling stressed, and then you have the snowball effect where the stress turn into depression. Then depression, it's a spectrum there. You have deep clinical depression. There are so many diagnoses with that, and how you deal with that. Then it starts to eat you up in the inside if you're not dealing with it. So we got to let that stuff out. But then we also got to put good stuff back in.
What is the most important thing people can do for their health and wellness?
You want to create a wellness routine for yourself, and that's what we do with our clients. So we create a lifestyle management plan, and that plan does not look the same from client to client. It's really based on their lifestyle, based on their needs. And so a care plan would be something like, you want to make sure you get 30 minutes of exercise in a day or every other day. It builds the endorphins. You have those good endorphins, the serotonin and the dopamine to help you feel good. It also, of course, contributes to, reducing the risk of heart disease and all of that. But you also want to think about, really take a really good look around in your life and in, what's triggering you? What's making you unhappy? Remove that thing. Put you first. I just told a friend, she was like, my back hurt, I'm tired, I'm exhausted, and I've been working week after week. And I said, you forgot to schedule in a vacation for yourself. And I looked at my calendar and I said, what if you took off the second week in October? She was like, oh yeah, I forgot about that. Yeah, you don't have to work forever. We're not robots. And so I know she'll be refreshed by the end of that week. So we have to put us first, and that's what the lifestyle management plan requires.
Where can people go to find out more about Chicago Integrated Health?
So you can follow us on Instagram and Facebook, Chicago Integrated Health. We're more active on Facebook, though. And then Integrated Health Chicago is our website. You can reach out, send us an email at hello at Integrated Health Chicago, or you can call us 773-234-7775. We accept Blue Cross Blue Shield PPO. We accept United PPO, and we're finalizing things for Medicaid. So, you can use your insurances.
Before we wrap up, is there anything else you'd like our audience to know?
Yeah, like I said, you are not your parents' disease. If you are in the middle of a fight, you really can reverse this thing. It's possible. Medications and everything is necessary, but you don't want to be on it for the rest of your life. It causes more chronic disease. So try to work in a holistic approach. Reach out to, if you have a holistic nutritionist or whatever that just reach out to them and add that to the routine. What I found was, because I never tell people to stop taking their medicine, what I tell them is, your doctors, when they see your labs, they're going to reduce the amount of medication based on how well you're doing. They will eventually take you off. Don't stop taking that medicine, but include it, the wellness routine, into your daily activities.
Great. Well, thank you so much for being here.
Thank you.
Remember to make plans to join us again next week for Conversations with the Citizen, the place where real news